Hi there, this is FCOA lesson 5C, how to teach medic first aid to divers. Now what we offer our participants is the shortest medic first aid course in the world. In any other course they would learn more. And yet we will give it because when things go wrong, the natural inborn tendency of people is to just watch and wait and believe that someone else will know better what to do. But as a diver, you are likely to be the first one around that can offer help, and sometimes you are the only one around that can offer help. We coaches have to change our own and our participants' mindset. When something goes wrong, then be ready to help. Be the first one to help. Start doing something logical. Don't try to be perfect, but just get into action. Accidents are messy. Maybe you will not be able to solve them, but you have to try. You have to get up and say, I'm going to deal with this as good as I can, and I'm not going to stop until this emergency situation has passed. The 5 topics we will cover are the most common emergencies in life that we normal people can respond to. They are choking, aquatic injuries, managing bleedings, CPR, and managing fractures. When you're the coach giving this lesson, then create some kind of dummy. Get a t-shirt or a wetsuit stuffed with pillows and use a dive mask as a face. If you're at a restaurant and all at once someone stands up and starts grabbing his throat and he turns blue and tries to scream but no sound comes out, then he is probably choking on a piece of chicken. In this case, there's no time to call an ambulance. There's no time to look for a nurse or a doctor. The only person that can do something now is you. So grab the victim from behind, place your fist in his stomach and pull inwards and upwards, trying to compress the lungs in the hope that a piece of chicken will shoot out of his throat. You cannot directly surround the lungs with your arms because the ribs are in the way, so you have to apply those lung compressions via the stomach. If that didn't work, then sit him down and place his head between his knees and slap him powerfully between the shoulder blades. If that also doesn't work, then sit him up and tell him to open his mouth. Stick your fingers in and try to find that piece of chicken. If you still can find that piece of chicken, then repeat this procedure. Every time you repeat, use some extra force. Don't be scared to cause blue spots. That piece of chicken has to come out of his mouth. If you're the coach, then let the participants try this 3 rounds on the dummy, not on a real person. Okay, next topic. Aquatic injuries. Jellyfish stings. Spray them with vinegar. Fill an old perfume bottle with vinegar and add it to your first aid bag. Don't scratch, cause you might move invisible tentacles to areas that are not affected. Coral cuts. Small cuts happen now and then. Just continue your dive, but afterwards clean them with water and soap, and once you can, apply a wound care cream. There's a lot of bacterial life on corals, so those cuts often start infecting a bit. If that is the case, you could also spray some hydrogen peroxide on them. Stonefish and lionfish stings. They hurt a lot and can cause swelling. The best you can do is soak the affected body part in hot water, as hot as 50 degrees Celsius. That is supposed to reduce the effects of the poison. Okay, next topic, managing bleedings. Imagine I fell through a window. I did cut open my wrist. I'm sitting here and the blood is squirting out of my wrist. What would you do? Well, directly stop the bleeding. Apply pressure. Best while standing, so you can use your body weight to apply pressure. Your first priority is to lose as little blood as possible. After placing a bandage, lay the person down and elevate the affected area. If the bleeding still does not stop, then apply a pressure point. Let's practice that. Let someone find your pulse and tell them to count out loud. 1, 2, 3, 4. Imagine that counting is the sound of your blood squirting out of your wrist. Now press below the bicep and towards the bone. You have to squeeze that artery between your fingertips and the bone. Keep trying until your body stops counting. There you go. You don't feel the pulse anymore, right? And I actually can feel my pulse behind my fingertips. I have successfully applied a pressure point. Next topic, managing fractures or broken bones. The general recommendation is to not touch people with broken bones and to just wait for professionals to arrive. But that is easier said than done. First of all, if after a motorbike accident an injured person is laying on the hot road in the sun, then you will have to move him. The road can get as hot as boiling water. The exiting method we have practiced in our rescue training, we can also use for moving a person a few meters towards shade and safety. Also, if you are on a small island and a doctor on the phone tells you to bring the victim to mainland, then you will have to transport him. In that case, find a way to stabilize the fracture. Bamboo sticks on both sides are great. Use 4 tie points, 2 above the fracture and 2 below. Make a stretcher out of any flat surface to carry the person for transportation. Okay, our last topic. In case you find a person laying on the ground, this is CPR by the way. In case you find someone laying on the ground, well, first check if they are not just sleeping. Shake them. If they don't wake up, first of all, make sure someone calls an ambulance. Then, look, listen, feel. Look if the chest is rising and falling. Listen for the breathing and feel with spread fingers if the chest is moving. If not, start with 2 rescue breaths. Open the airway by holding one hand under the neck, close the nose with the other hand and blow into the mouth of the victim. As you blow, check if the chest is rising. If not, then you got to change something. The heart is not pumping, so you will have to pump it. The right place to apply pressure is 2 fingers above where the ribs come together. Now press and count fast towards 15 at this speed. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Again, 2 rescue breaths and continue with those 15 compressions again. Get used to the rhythm. Keep going. Practice it for at least 3 minutes. If you're the coach, then simulate the chest movements when they breathe in, but only if they're pinching the nose and extending the airway. Also note that the arms should be straight and that the movement should be coming from the hips. The shoulders should be right above the heart area, so that it doesn't become an exhausting exercise. It's an exercise that moves out of the hips. After 3 minutes we pretend the person starts breathing, but he is still unconscious. Then place him in the recovery position. The main objective is to have the mouth facing to the floor, so his saliva or vomit will fall away. That's it, folks. That's our mini medic first aid practice. If you get a chance, follow a course with the Red Cross, but most of all, when shit hits the fan, get into action and do what you can.